It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show featuring some of the best doctors in the Houston area that are really changing people's lives. Let's get today's show started with vein specialist, Dr. Peter Morgan.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radio frequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much, even though they say, well, it's not going to hurt, it's not going to hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
Coronary artery stenting is a part of interventional cardiology that I absolutely love. It's been around for about 30 years now. Initially, the great giants of cardiology formed a cardiac stent, which is just a metal mesh that we place on a balloon catheter, place it into the coronary artery that's obstructed, open it up, leave the stent, and remove the balloon and the catheter. Easy procedure, but years ago it was quite difficult, and catheters were larger, there were a lot of bleeding problems, but now the catheters are quite small. The procedure is fast, done quickly and without much discomfort at all for the patient. If a patient presents with coronary artery blockage, they can go to the cardiac catheterization laboratory, have the coronary angiogram procedure done, and then if there's a blockage, we can place a stent right at the same time. Coronary stenting has protected many patients from going to cardiovascular surgery, has improved lifestyle, and many patients have gone without symptoms for many years because of coronary stenting. We thank the developers of coronary stenting, and we look forward to a future of great developments with regard to the coronary stent.
I weighed 236 pounds. It was just time. I needed to do something to feel better, healthier. I needed to feel healthier. I needed more energy. I needed to do something. I had the lat band as opposed to the sleeve or gastric bypass because it was less invasive and it was really the right decision for me personally.
She's increased her exercise in response to having the control to lose the weight more easily, so there's a positive reinforcement there. If they do the right thing in terms of exercise, if they're consistent, then they see a bigger drop-off than they had seen before they had the surgery.
As time went on, I started dropping the weight, eating, slowly, liquids and then your soft foods, the way that you were told to do it. And things just started to work out for me. I started exercising more and eventually it just started falling off.
Right now she's running, she's trained for a half marathon. And those are great things in terms of the exercise side of taking care of the weight. When it comes to eating, it sounds like she's doing a fairly good job switching to things that are lower calorie, less animal fat, and lower glycemic index. But it sounds like something, occasionally she eats things that aren't ideal for her. But I think her exercise takes care of that, and that's why she's at ideal body weight right now.
Physically, to be able to not huff and puff going up and down a flight of stairs, mentally, to work, to educate yourself. I think it makes it easier to feel confident about yourself. It just makes things that much easier. Before the surgery, I was 236 pounds, and 3 years later, I am down 85 pounds.
Unfortunately, with a lap band, it's difficult to tell sometimes ahead of time who's going to do well and who's not going to do well. And we have patients that do very well with it, and that's great. The problem is the predictability when it comes to the lap band. So she's an example of someone who's used it as a tool the way it's supposed to be used. Unfortunately, that isn't the case with everybody.
The two main types of germs that cause infections in human beings are viruses and bacteria. It's important to know the difference. A virus basically just needs time and supportive care. A bacteria usually and often needs an antibiotic. Viruses are much more common than bacteria. A viral infection usually comes on gradually, whereas a bacterial infection tends to be more sudden. A viral infection tends to cause a lot of muscle aches, whereas a bacterial infection doesn't. The virus does that because it lives in the capillaries in your muscles, and the muscles have a lot of capillaries. Bacteria don't live in the capillaries, and that's why your muscles ache a lot with the virus and not so much with the bacteria. In a viral infection, you tend to have multiple organs involved. For example, you have a runny nose, a cough, and a sore throat. In a bacterial infection, it's usually just one site, like a sore throat only, or sinus infection only, or a cough and bronchitis only. And those are the main ways to tell. Also, a virus tends to have a little bit of a more protracted course. It may last more than 5 or 6 days, and a bacterial infection usually goes away quicker, especially when you take antibiotics.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
All you have to do to request an appointment with one of our amazing doctors is head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. Now let's go ahead and check out our next doctor, podiatrist Dr. Gabriel Maislos.
Many present in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe, where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think probably about a year. And so it had got so bad, I couldn't even wear a shoe. So that's what really made me came in, to have surgery on it.
The next step was for us to take an X-ray and to evaluate her foot and determine what kind of, surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better. You know, no pain. You know, it just felt better. And I was so happy, you know, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, you know, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump, because first it gets red, and next thing you know, you have a wound. And that can be problematic, because then you can get an infection to the bone.
I mean, it's not sore or nothing. It just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. You know, a lot of people are concerned that they've heard from their neighbor, or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and you know, we've really come a long way with our surgeries.
Sitting in an office chair all day can be tough on your joints and can cause knee pain. In order to ease the pain, be sure to stretch your legs straight out and tighten your quadriceps 5 times for about 10 seconds. This will help to lubricate those knee joints.
I am a World Series champion.
I am a husband.
I am an advocate.
I'm in the fight for colorectal cancer.
Because I lost both of my parents to this disease.
Because of my friend who died 120 days after his diagnosis.
As a survivor, I want to spread the word so everyone out there knows the importance of early screening for colorectal cancer.
One simple test can save your life or someone you love.
Get screened.
Be a part of 1 Million Strong.
We are 1 Million Strong!
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a 3-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall cost significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varughese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and he had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varughese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Let's go ahead and introduce you to ear, nose, and throat specialist, Dr. C.T. Nguyen.
I was experiencing a sinus, like an ongoing sinus infection for like the past 2 years. I was feeling congestion in my nose and ears and throat. Fever, body aches, headache.
Alondra can't breathe through her nose. She feels pressure in her face, her ears, and most importantly, she had this constant post-nasal drip that make her cough all the time.
Constant feeling like you're tired. You know, you're feeling like you've got to go to work, but you feel not 100%. And it would also affect my social life because I was always so tired out of feeling sick that I would just decide to just stay in and not really go out.
Upon examination, I noticed that her nasal cavity and sinus are completely blocked. She can't breathe through her nose, and decided upon a plan of treatment that consists, obviously, of allergy avoidance and allergy control combined with a turbinate coblation. It's a technology using radio frequency to reduce the swelling on the side wall of her nose, increasing her capacity to breathe through her nose and improving her nasal allergy symptoms.
After the procedure, I no longer experienced the symptoms that I was experiencing before. I noticed that I could breathe a lot better, like I just want to say I could breathe.
Alondra was very happy with the result of the treatment. We actually found the cause of the problem and targeted our treatment. Alondra breathed better, she feels better. It's a new person. Medicine has advanced so much that there's always a solution to breathe well and live well. Patient doesn't have to suffer anymore.
I no longer felt congestion. I wasn't getting sick every month because I no longer had that infection inside of like my sinus passages. So I want to say I feel great now.
Our bodies need at least 90 milligrams of vitamin C per day. The best way to get all your vitamin C is by making sure to eat at least 5 servings of fruits and vegetables every day.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing that's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
For more information and to check out hundreds of videos, head to our website, bestdocsnetwork.com. Having a smile on your face can boost your confidence leaps and bounds. Let's check out someone who can help give you a winning smile. It's cosmetic dentist, Dr. Guy Lewis.
I came to Dr. Lewis because I always wanted to have really white teeth. And my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger. Even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness. but it's derived from the bond to the tooth, and we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody, because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
Eating slowly will not only help you to feel fuller and more satisfied, it can also help prevent indigestion and heartburn. So slow down and enjoy your meals.
I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back in home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A, and after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
That's all we have for today's episode of Best Docs Network, the show featuring some of the best doctors in the Houston area that are really changing people's lives. For more information, head to our website, bestdocsnetwork.com. And if you have a question or comment or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Happy holidays, and I'll see you next week.